Hello everyone, I am Dr Abhijit Whatkar. I am general and laparoscopic surgeon working as a senior consultant with Noble Hospital, Hadapsar. Gallbladder diseases. It's way too common nowadays because of the sedentary lifestyle of the patients, because of the work stress. The dictum which was already there, like 40, female and fatty, it's nowhere correlated with the sedentary lifestyle which we are having right now. Gallbladder stone starts appearing whenever there is physiological changes associated with diet. The main complaints when a patient comes to you may not be only acidity, it can be indigestion. Many patients who are coming up nowadays because of the COVID scenario, they are sitting at home, there is no physical activity whatsoever. There is home diet, but there is not proper timing associated with it. Obviously, there is very less physical exertion. Because of that, the fatty deposition, because of stagnation of bile for longer period of time, now the gallstones have been formed. The commonest gallstones which we are coming across are cholesterols, but majority are mixed stones. Now, how to deal with it? Because many patients will come to you with signs of indigestion, and obviously they must be taking some over-the-counter antacids, but that will only cure the symptoms, not the disease, which is the main cause of over and repeated attacks of acidity. So basic treatment is antacids, but if it is not getting controlled with antacid, you have to go ahead with a basic investigation, that is sonography on abdomen. Now the question comes, if you have a gallstone, then how to deal with it? The surgical call is usually taken when the patient's been taking treatment since long time and it's only symptomatically relieved whenever he takes medications. Surgery is needed whenever this conservative line of management is not where required. Patient cannot continue it for more than 2 or 3 weeks. It also depends on the size of the stones and the number of stones. When the size of stones reaches 3 to 4 mm, if it is a single 3 to 4 mm stone, we don't usually advise surgery, because solitary, that means single stone, size, that means less than 4 mm, can be treated with medications. We can dissolve it. And obviously there are medications which will avoid the further stone formations also. So the decision of surgery we usually take when there are multiple stones, stone size more than 4 mm, there are any changes related to gallbladder per se, that means the gallbladder itself is inflamed, there is minimal collection outside. This is just to avoid any gallbladder perforations or gallbladder complications. We have come across many gallbladder related complications such as burst gallbladder, then multiple gallbladder stones induced pancreatitis. Pancreas is just below your gallbladder. When a small gallbladder travels down the hepatobiliary tree, that means the biliary tract, and it blocks the pancreas. So many patients are coming up with gallstone induced pancreatitis as well. So to avoid these many complications, we have to plan the surgery when the gallbladder is at rest. That means there are no infection or inflammation associated with gallbladder. The type and the gold standard treatment for gallbladder surgical removal is called as cholecystectomy. It can be done by keyhole technique or minimal access surgery, also called as laparoscopic cholecystectomy. It's a daycare procedure. Just come one day prior, we get all the investigations done. Next day morning the surgery is done. Same day evening the patient is discharged, and patient can regain his physical activity and work profile the very next day. Here at Noble Hospital, we have 6 operation theatre. 2 of them are completely dedicated to minimal access surgeries, and we are all well equipped with high definition cameras and camera systems for minimal access surgery. Thank you.